Obstetrics is in my blood. You know, my dad is an obstetrician, my uncle's an obstetrician. I'm the fourth in the family to be an obstetrician, and we have 3 more coming after me. We have 2 more practicing, and my oldest son is going to be an obstetrician in 6 more months. So you could say it's genetic. Well, I love delivering babies. I love the rush of coming to the hospital, helping a woman out, delivering, catching babies, being with the families. I love setting up the right environment for the patients to get the birthing experience that they're looking for. I love helping out my fellow doctors. I love being with my midwives and just making the birth experience empowering and memorable and special, something that everybody will remember. That's my favorite part. Being an obstetrician and gynecologist has a lot of challenges. We have to see patients in the office. We do wellness checkups. We do prenatal checkups. We do surgical consults. We do surgery. We do deliveries, sometimes all of them in the same day. So having a smile on our face, a positive attitude, helping women get through these processes, sometimes all at the same time, is probably the biggest challenge of being an OBGYN. My most memorable experience was when I was a resident, there was a patient who came back and forth to the hospital probably 30 times thinking she's in labor. And eventually she did go into labor. Now we knew that she had triplets, so we were, very worried about her delivery. So when she finally went into labor, she actually popped the first baby out vaginally. We rushed her back to the operating room, delivered the other 2 babies, and then we found a 4th. So she ended up with quadruplets when we thought she only had triplets, and all kids were healthy. I remember seeing her a month later in the hospital cafeteria with the babies in the stroller and, just talking with her about the experience, and she introduced me to the babies. She had 3 girls and a boy. She named them Lillian, Gillian, Jillian, and Fred. And I'll never forget her. And it was really one of the most fun experiences in my history. And I've done a lot of deliveries, and that definitely stuck out as one of the more fun deliveries I've ever done. So if you ask me to describe myself in 3 words, I'd say I'm passionate, I'm dedicated, and I'm supportive. I've been a solo practitioner for so many years, I have no spare time. I basically devoted myself to my practice, my patients, and my midwives. Since I joined Orange Coast Women's Medical Group, in my new free time, maybe I'll play golf, maybe I'll travel, but I'm probably going to spend more time with my wife's Mental Health Awareness Foundation. I'm going to participate in the Hoag Foundation, and I'm probably going to do more outreach programs with my temple. The Orange Coast Women's Medical Group has 20 doctors, 3 nurse practitioners, 4 midwives, all different ethnic backgrounds, different cultures, different beliefs, but we all share the same passion for OBGYN. I think we hire the best talent. We have the brightest and newest people joining the group, whether it's doctors or midwives. The one thing that we really do is we support our midwife program, allowing them to have the midwife model of care, which nobody else can match. Nobody has the experience we have for that program. We also have so much to offer in our practice, whether it's mammograms and ultrasounds and bone density and natural hormones and nutritional support, all this under one roof. It's really the one-stop shopping. How cool is that?